In response to the COVID-19 public health emergency, and after taking into consideration the National Institute of Health, or NIH, guidance, the Centers for Medicare and Medicaid Services, or CMS, has created a new Healthcare Common Procedure Coding System, or HCPCS, Level 2 code for Veklury, otherwise known as Remdesivir, for use in the outpatient setting. HCPCS code J0248 is effective for claims with dates of service on or after December 23, 2021. CMS released this information in the MLN Connect Special Edition for Friday, January 7, 2022. A link to that article is provided in the description below. Veklury, or Remdesivir, is FDA approved for the treatment of COVID-19 in hospitalized patients. The FDA label states that Veklury should only be administered in a hospital or in a healthcare setting capable of providing acute care comparable to inpatient hospital care. There are various U.S. guideline recommendations on the role of Remdesivir. Following the recent statement from the National Institute of Health, or NIH, COVID-19 treatment guidelines panel regarding therapies for COVID-19 Omicron variant, CMS created HCPCS code J0248 for Veklury, or Remdesivir, antiviral medication when administered in an outpatient setting. Coverage is based on the NIH COVID-19 treatment guidelines. These guidelines are specific to the therapies for COVID-19 Omicron variant. When administering Remdesivir, providers should follow the current labeled guidelines for administration. Refer to the Remdesivir FDA label for additional information about the product. Be sure to administer Remdesivir in a setting where you can manage severe hypersensitivity reactions, such as anaphylaxis. As your MAC, we want to provide guidance on billing the J0248 to prevent impacts to your claim processing. Submit your claims with Veklury or Remdesivir, product code J0248. Please refer to the Remdesivir FDA label for additional information about the product. Use ICD-10 code U07.1 for COVID-19 or J12.82 for pneumonia due to coronavirus disease 2019. In addition to the product code J0248, use the following CPT code for administration: 96365 for intravenous infusion for therapy prophylaxis or diagnosis, initial up to 1 hour. And if needed, use 96366 for intravenous infusion or therapy prophylaxis or diagnosis each additional hour. For Part A outpatient claims, be sure to use the appropriate type of bill and the appropriate revenue code. For Part B outpatient claims, be sure to report the appropriate place of service code. Refer to the NIH COVID-19 treatment guidelines panel for administration information. When reporting the units administered for the patient, the J0248 represents 1 milligram and units should be adjusted to reflect the dosage administered for each patient. Finally, claims submitted with dates of service on or after December 23, 2021 will be held until the claim processing systems are updated. Thank you for taking the time to listen to this video. If you found this information helpful, please like and share it, and make sure you subscribe to our YouTube channel.